Welcome back to the pharmaphorum podcast. In this episode, I speak with Dr. Sharmeen Roy, Chief Scientist at DoseMe, a Bayesian dosing platform combining smart technology with science, who joins me here for a conversation on precision dosing. From the whys and the wherefores to the hows of correction of historical error and resultant adverse events due to lack of identification of our individuality as patients, be that based on age, sex, height, weight, or other biological variable. The challenges are many, but in order to provide due care to all patients, the data needs to be identified and acted upon, and medicinal dosing made precise and personalised. Tune in, share your thoughts if you wish to send in comments, and, as ever, thank you for listening. Welcome to the pharmaphorum podcast. This is web editor Nicole Raleigh, and today I have with me Dr. Sharmeen Roy, Chief Scientist at DoseMe. We'll be discussing precision medicine tools and how pharmacokinetic, or PK, and pharmacodynamic, or PD, characteristics are a trend in pharma at the moment, from lead identification right up to final stage clinical trials. Welcome, Sharmeen.
Thank you, Nicole. I'm really happy and delighted to be here.
So DoseMe is a Bayesian dosing platform combining smart technology with science, leveraging clinically validated pharmacokinetic drug models, patient characteristics, drug concentrations, and genotype to accurately individualize a dose. Bayesian dosing was developed to overcome the issue of variability between patients and provide more precise predictions of drug concentrations and target achievement early on in therapy. The Bayesian method uses information on the drug's behavior in previous patient populations, in conjunction with the current patient-specific information. That includes weight, measured drug concentration or concentrations, and PK parameters, as well as being calculated based on the administered dosing regime to develop a precise dose recommendation for a specific patient. Indeed, personalised dosing results in better patient care. And listeners might in fact have tuned in to pharmaforum's conversation earlier in the year with closed-loop medicines Hakim Yardi discussing the importance of personalised dosing. If you haven't, be sure to have a watch of that video after listening to this podcast. But before we get started on today's discussion topic, Sharmeen, perhaps you could introduce yourself for listeners a bit more. Tell us about your journey to today, doing what you do at DoseMe.
Sure. Thanks, Nicole, for that. So my journey, I would say, began in clinical practice. I'm a clinician. I started as a pharmacist in pediatric critical care, where I provided direct patient care. Being the population that I was taking care of, which is pediatric patients, we were focusing on optimizing treatments for various conditions. And we know that our youngest patients require the most tailored and individualized dosing, just due to their size and physiology. So precision dosing, I guess I could say, is something I've been practicing since, I completed my training. And over time, I've really been fortunate, lucky, to be in the centers that I practiced at to work with various technologies quite early, and really integrating it into our clinical workflow. I guess technology has always been something that has run in parallel with the various roles throughout my career. So really leveraging technology to streamline clinicians' workflow as well as making treatments even more effective for patients has sort of been the core focus. So fast forward to my current role here at DoseMe, here we combine, as you described earlier, clinical data with advanced Bayesian dosing algorithms to tailor drug doses to individual patient needs, and improving the therapeutic outcomes, and really not only just focus on outcomes with efficacy as it relates to efficacy, but also minimizing adverse effects, because that is a cause of needing to change medications or constantly adjust dose. So we're trying to minimize that, so we can take care of patients quickly and achieve those positive outcomes.
Thank you. So pharmacokinetics refers to the movement of a drug into, through, and out of the body, or the time course, if you will, of its absorption, bioavailability, distribution, metabolism, and excretion, the onset, duration, and intensity of a drug's effect. And then pharmacodynamics concerns what a drug does to the body, involving receptor binding, post-receptor effects, and chemical interactions. So I was just wondering, Sharmeen, if you could explain for listeners what this all means when it comes to precision dosing specifically.
Yeah, so when it comes to precision dosing, these concepts are crucial, right? Because we need to understand how a drug moves through the body, which is the pharmacokinetics, as well as what it does to the body, which is pharmacodynamics. And it helps us with both those combined, helps us to get to the more individualized dosing and the targets that we're aiming for. And it allows us to predict how different patients will respond to the same drug. So you and I can take the same medication, but we may not have the same response, and that's all. That's kind of the focus of precision dosing, isn't it? Because we want to make sure that we're making sure to adjust and tailor dosing for each individual patient and optimizing those therapeutic effects and really minimizing side effects. And, we know that we all respond to medication differently. And sometimes we have that information readily available because it was part of the approval process and, what has been studied in patients. But oftentimes we're just unsure because there's so much variability between patients and how they may respond to medication. So that's really crucial to making sure that we are precisely dosing all of our patients.
Yes, as you say, we're all individuals, and that's not just sort of personalities, that's very much biologically fact-based. But I was just wondering if you could comment upon this sort of uptick in this trend for dosing, personalization, and precision. I mean, there has been an evolution of this trend into a more central concern recently, hasn't there?
Yeah, and we'll take it. It's all good to bring attention to this. There's a lot of terms that are used interchangeably: precision medicine, personalized dosing, precision dosing. So all of those I feel like kind of fit into one big umbrella, and precision dosing really has gained prominence due to several factors. First, there's a growing recognition that one size fits all dosing often leads to suboptimal outcomes and also, adverse outcomes. Patients, like we talked about, we're not only different from individuals that are different personality, but we do metabolize. Our physiology is different. We metabolize and respond to drugs differently. And that can be based on our genetics, our age, weight, organ function, and other factors. We're really looking to the advances in technology and data analytics, which has made it possible for us to collect and analyze this patient-specific data more effectively. With that, I think there has been a movement towards that precision dosing, and it's become a reality where we're able to use and leverage these tools to really get to that precise dose. And additionally, the push towards personalized medicine and increasing availability of pharmacogenomics information has really highlighted the need for that precise individualized dosing regimen. Many of these drugs get approved, through standard clinical trial designs, and there's a lot of underrepresented populations. So we want to make sure that we're using technology as an asset and really seeing how we can improve patient care, and that's really been the focus of precision dosing for a lot of this kind of momentum that you're seeing.
Thank you. Yes, as you mentioned, this one-size-fits-all mentality. Strange that it ever applied, really, because women aren't just small men and children aren't just small adults. So it's really heartening to see this trend really taking hold. But you mentioned there at the end, when you were replying to my previous question about clinical trial design. So I was just wondering if you could go further into the changes in clinical trial design and running clinical trials when it comes to having clinical trials focused on precision dosing.
And I will say it's changing. It's a work in progress. So I don't think we're 100% there yet, but we're happy to see that there is a movement towards changing the standard clinical trial design. So drugs go through various stages of studies to develop and optimize. Sort of dose finding expedition, where you trying to figure out what the optimal dose is for a given patient. Now, traditionally, this is often based on the previous clinical trial designs. It's often fixed dosages for all participants, which really mask the true efficacy and safety safety profiles of the drug. So, what the patients that we may enroll and study, use for these medications in a trial are not necessarily the patients we're treating. They're not the patients that we're, taking care of on a day-to-day basis. So many of these medications get approved for a set, very controlled environment, a very controlled cohort of patients. But in reality, we know that there's a lot of variability in patients. So what the push towards changing clinical trial design is to get away from, finding the maximally tolerated dose, for example, and really figuring out a better trial design to be able to treat more patients that we are seeing in our hospitals, in our acute care setting. And with precision dosing, with the change that is happening with clinical trial designs, we can adjust those dosages based on individual PK/PD profiles. There's a wealth of data that is generated as part of the long process of a drug approval. And we need to utilize that to really see how we can apply it once the drug is actually approved and we're dosing those various patients. So for example, previous dosing method might have led to higher rates of adverse effects or even lower efficacy in certain subgroups, specifically those that are maybe underrepresented in the trial population. And so now, incorporating the precision dosing software or tools that we have, we can identify optimal therapeutic windows for different patient populations and really enhance the overall success of not only the clinical trials, but the utility of the given medication. So we really want to make sure that we're, taking care, being able to utilize that data to take care of all patients, even those that may not necessarily be representative in a trial study population.
Thank you. And can you tell us more about how companies like DoseMe are becoming part of this change, facilitating this adaptation?
Yeah, I'm someone who, when I started my career, we're doing a lot of these manual calculations at the bedside. I often say I wish I had a software like DoseMe RX when I was practicing, because it would really have made taking care of patients in a busy pediatric ICU a little bit easier. But to be frank, companies like DoseMe are really at the forefront of this field, providing platforms that integrate smart technology with, scientific models, PK/PD models, and our Bayesian dosing platform leverages that. We have clinically validated pharmacokinetic models that takes in patient characteristics, drug concentration, even genotype data to individualize dosing. The goal is to provide this at the bedside because, as I said, you can do everything and incorporate all this information manually, but we're all strapped for time. So to make this a little bit easier and allowing healthcare providers to make data-driven decisions, and you can do it at the bedside quickly, so you don't have to kind of do a trial and error on dosing is really the goal here. And I think DoseMe RX as a software provides that ability and makes it a little bit, like I said, easier at the bedside for the clinician. So, they can use the data that's available to make the most informed decision.
Thank you. So the final question, what's the horizon like for personalized dosing, in your opinion? That can be the next 5 or 10 or even 50 years' time, but where is this going? What's the ideal outcome?
So I'm an eternal optimist. I would say most of us are in healthcare. So, we're all striving to continuously improve the care we provide for our patient and, keeping the patient in the core of anything we do. The horizon for personalized medicine is, I think, incredibly promising. In the next 5 to 10 years, I think we can expect widespread adoption of precision dosing tools in clinical practice. They're sort of already there. And, sometimes you have to pause and remind people that they're already implementing some of the precision dosing tools and software is available, but it's going to be driven by continued advancement in genomics and data analytics, as well as digital health technologies. I think these tools will become integral to personalized medicine, and really, again, going back to the patient, making it safer for patient safety should be at the core of anything we're doing when we're developing these softwares to help the clinicians. I don't think we have an option really, because our patients are changing. They're becoming more and more complex. I mentioned that I trained in pediatrics, and the challenge was that dosing children was very challenging because there was a lack of studies and lack of data in pediatric patients. But now we have the other end of the spectrum. We have a population that's aging. We have the same challenge there. In order to provide care to all of our patients, including those that were, like I mentioned earlier, part of the cohorts that were in clinical trials, we have to take advantage of the technology that's available, the data that's available, and evolve. And I don't know if I can look 50 years into the future, but I don't think it will take that long, to be honest, because of how quickly the landscape is changing. We envision, healthcare landscape where real-time monitoring, AI-driven analytics allow us for continuous optimization of treatment regimen. Anybody you talk to nowadays, they have a smartphone, they have a smartwatch. So just the vast amount of data that's out there that can be utilized to really individualize dosing is at our fingertips. We just need to integrate all of those tools to be available when we're making these treatment regimens.
Thank you, Sharmeen. It's been a pleasure.
And so that concludes another episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaphorum.com.
That concludes this episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about other installments in the series
Spotify,
at pharmaphorum.com/podcast.
And pretty much
the
wherever you
Pharmaphorum
get your
podcast
other
is also
podcasts.
available on iTunes,
Just
Spotify,
search for
Acast,
Pharmaphorum
Stitcher, and
press
Podme,
subscribe.
where you can find and
Of course,
subscribe by
don't forget to
searching
visit
for
our
Pharmaphorum.
website itself.
And don't forget to
where you
visit
can
our
sign up
website,
for
where you can sign up for daily
weekly
news and analysis bulletins, and to follow us on Twitter
And do follow us as well on
pharmaphorum.
X or
Thanks for
Twitter
listening.
and LinkedIn at pharmaphorum. That's all for now. Thank you for listening.